with very long-term benzodiazepine use, um, we can actually make the patients dependent on benzodiazepines. The National Institute of Clinical Excellence says they shouldn't be used for more than 2 to 3 weeks, and the largest class action in history in the United Kingdom, which involved several thousand general practices and multiple health service districts over there, was where clinicians and health service districts were being sued for prescribing benzos for maintenance. So that class action was actually eventually failed when the government worked out that they were the health service districts and changed the law. But it was the largest class action which went for many years in the history of the United Kingdom, and it was over benzodiazepines, because the instructions have always been not to use them for more than 3 weeks at a time, except in the case of clonazepam for seizure disorder. But for every other benzo, the short-term use is appropriate. So the iatrogenic damage done by benzodiazepines long-term is certainly prevalent and statistically valid. The other problem is, of course, is that if you've had a patient on benzos for a long period of time, it is also inappropriate to abruptly discontinue, because then you make the matter far worse. The general saying is, if we're being complicit in adding to the problem, we have to be present in solving the problem as well. And it's something that has occurred over a long period of time, and benzodiazepines, because they were thought to be so safe and are safer than many other drugs in overdose, their use for a long period of time was growing. Now it's starting to shrink down again, so we have to just make sure we do that in a controlled manner, so that having set this crutch up for the patients to use, we don't abruptly pull it away.